Please introduce yourself and what your practice is.
I'm Dr. Sabeena Kathuria. I work at Virginia Mason Catholic Health, and I'm a pediatrician by profession.
What are the common symptoms that alert you that a patient might have PCOS?
So, when a young lady comes and she has had irregular menstrual cycles or having no menstrual cycles for about 3 to 4 months consecutively, or as I do an exam, I find out that she has got a lot of facial hair. She's getting hair on places where, you normally won't see hair, like the upper lip or the chin or on the chest. She's slightly more on the obese side. She has passed that stage where I know she may not have amenorrhea secondary to the fact that she has already started her periods. That kind of gives me a little bit of a head start that I need to start looking at other causes of what could be causing some of these symptoms.
So, how do you differentiate between PCOS and just regular, puberty symptoms?
So usually it also, obviously, you can have irregular menstrual cycles for the first 2 years after you start your periods, right? So this is a very gray zone because a lot of girls will come and say, hey, we've kind of missed our periods for 6 months. So you not only look at that, but you look at other signs and symptoms that you find on exam. Suddenly I find this patient's BMI is very high. I've gotten a history from her that her mother or someone in her family, usually first generation, had PCOS. I look at the hair distribution. I kind of see that if she has some central obesity, has she started losing some hair and she's getting the male sort of balding pattern. These kind of all make me feel that I need to do a little bit more than just blame it on puberty.
How rigorously do you screen patients for PCOS? Like, do the whole diagnostic process?
Sure. I think pretty aggressively because I think this is one of those diagnoses that kind of gets delayed because, like you asked a very important question, these could be signs of puberty that the girl hasn't had periods. So if I put the whole picture together with what I'm getting from my history and from my exam, then I aggressively try and approach it because studies have shown by doing early intervention we may be able to reverse PCOS.
So, what is the diagnostic process for PCOS?
So obviously, first is based on history, a very, very good exam. Lab tests usually just kind of confirm, but not really diagnostic. So we look at some hormones that are produced by the ovaries. We look at testosterone levels because those are usually high. With PCOS, you can also have insulin resistance, so you can look at insulin levels. The old theories, because I'm sure through your reading, you're finding out that the diagnosis of PCOS and the approach of ultrasound and looking for follicles on the ovary is not, it's something that's changing over time. Initially, when the diagnosis of PCOS came out, they said, oh, you should do an ultrasound. And now they're saying the ultrasound really doesn't help unless and until, you're worried about infertility and you're looking at follicles. And then the number of follicles change with age appropriate too, right? So if you have follicles at a 16-year-old compared to a 40-year-old. So usually I would say hormonal testing will be one thing. I would also look at the testosterone levels. I would also look at the cholesterol levels to see if their lipid profile is normal. I will do a fasting glucose because you can have glucose intolerance. Will be the basic tests I would do. But I feel that these just help. But more than about 80% of the time, just based on history and exam, you're able to know that this person may have PCOS.
And our last question is, how do you treat PCOS in adolescents?
Right. So the first approach, which is being told, is to control diet. So if a person is obese, weight loss has really been shown to be able to reverse some of these effects of PCOS. So my first approach is always to discuss nutrition. If the patient feels they'd like a nutritional counselor who can help them, we'll go ahead and make a referral to that. I'll watch them very carefully and bring them every 3 months to kind of follow up on their weight, talk to them about the BMI, healthy lifestyle, balance between nutrition and exercise. Now, let's say I've done that, and obviously I have failed or the patient has not been able to make the periods regular. Then we talk about contraception, right? And there are different forms of contraception because we're trying to balance the hormonal levels of the estrogen and progesterone. Let's say we give that a try. If the patient has a lot of hair, like the hirsutism is affecting the child because cosmetically, obviously, the child is being teased or they want, then we can add medications like spironolactone to help reduce some of the hair. Um, if all of that, usually the combination of oral contraception with spironolactone or medications of that form usually can help regulate their cycles. And once I'm able to regulate their cycles, and I also forgot to say that obviously there are other reasons why you can have increased amount of testosterone in your body, right? So while I'm doing the workup or getting a history, I want to make sure that there's no other focus that could be producing these hormones before I make a final diagnosis of just PCOS, right? But that goes in depth into what kind of history I'm getting, what kind of exam I'm getting to decide what further testing. So to let you know, my first approach is always diet and nutrition, followed by oral contraceptives, and then treating each symptom that is associated with PCOS. For example, if they have insulin resistance, if they have high cholesterol, if they have sleep apnea, if obviously their emotion, mood, and anxiety secondary to PCOS. So each one of those are then treated separate.
Okay, thank you so much. This was
Thank you.
You
very
are welcome. Anything else I can help you, young ladies?
no
I
thank
think I think it's a wonderful project because there's so many gray zones on that. And I think when you're done with your presentation, not only presenting to patients, but even to providers to say how do you early catch on and how they should be more awareness would be an awesome thing.
yes.
All
Thank you.
right. Good luck, both of
Thank
you.
you.
Have a great evening.
You too. Bye-bye.
Bye.